Namaskar. Welcome to my YouTube channel. Today we are going to discuss about Aiims Norcet previously related most important question answer. Part 12. Let's start. The first question. A patient admitted in hospital and suffering from pain, stiffness and fever for 3 days. He is confirmed with HAI. When should a nurse tell the patient about HAI? Option A, on admission. Option B, after 1 day. Option C, after 2 days. Option D, at discharge. The correct option is option C, after 2 days. A nurse uses DPT vaccine and found that vial has granules. What is the next nursing action? Option A, discard the vial. Option B, shake vigorously. Option C, check after 15 minutes. Option D, keep using the vial. The correct option is option A, discard the vial. After blood transfusion, sign and symptom of circulatory overload is option A, tachycardia, tachypnea, jugular vein distension. Option B, bradycardia, hypertension, fever. Option C, bradycardia, hypotension, fever. Option D, tachycardia, fever, hypotension. The correct option is option A, tachycardia, tachypnea, jugular vein distension. Which behavior therapy should be given to a patient suffering from leg pain and stiffness? Option A, hypnosis. Option B, relaxation. Option C, meditation. Option D, medication. The correct option is option B, relaxation. Hypokalemia is seen in option A, burn. Option B, increased uric acid. Option C, Addison's disease. Option D, nasogastric suction. The correct option is option D, nasogastric suction. In a 20% burns patient, how should we check the fluid volume? Option A, weight. Option B, skin integrity. Option C, strict intake output. Option D, height. The correct option is option C, strict intake output. A RTA patient came to the emergency room. By which method should the oxygen be administered in this patient? Option A, simple mask. Option B, rebreather mask. Option C, nasal cannula. Option D, non-rebreather mask. The correct option is option D, non-rebreather mask. Furosemide injection is administered to a patient for which action? Option A loop diuretic to prevent excessive fluid volume. Option B, acts as ACE inhibitor. Option C, prevents gastric movement. Option D, is a thiazide diuretic. The correct option is option A loop diuretic to prevent excessive fluid volume. A child is on chemotherapy. The nurse should teach the mother about the following except option A, hand washing. Option B, avoid crowded place. Option C, brush 2 times. Option D, seize bath. The correct option is option D, seize bath. A patient in the ward suffered sudden cardiac arrest. Which method of intubation should be used in this patient? Option A, jaw thrust method. Option B, head tilt, chin lift method. Option C, Valsalva maneuver. Option D, Heimlich maneuver. The correct option is option B, head tilt, chin lift method. According to IMNCI, dangerous sign of sick baby includes option A, persistent vomiting. Option B, sole and palm are yellow in color. Option C, fever. Option D, watery eyes. The correct option is option A, persistent vomiting. How to tie an ET tube to an adult patient to prevent bedsore? Option A, cheek to cheek. on the ear. Option B, cheek to cheek over the ear. Option C, cheek to cheek above the ear. Option D, cheek to cheek over the neck. The correct option is option C, cheek to cheek above the ear. A 5-year-old baby drank kerosene accidentally. What is the priority management in this case? Option A, gastric lavage. Option B, NPO till help arrive. Option C, induce vomiting. Option D, give activated charcoal. The correct option is option B, NPO till help arrive. A 32-week pregnant mother is having abdominal pain, tenderness, and fetal distress. What will be the diagnosis in this patient? Option A, abruptio placenta. Option B, placenta previa. Option C, abortion. Option D, ectopic pregnancy. The correct option is option A, abruptio placenta. In a 35-year-old female, USG shows 2 mm mass and CA125 is reactive. What is the diagnosis in this patient? Option A, ovarian cancer. Option B, cervical cancer. Option C, mucosal cancer. Option D, uterine cancer. The correct option is option A, ovarian cancer. Core body temperature can be measured using all of the following methods except option A, oral, option B, rectal, option C, temporal artery, option D, esophageal. The correct option is option C, temporal artery. Identify route of drug administration. Option A, subcutaneous with Z-track. Option B, IM with Z-track. Option C, IV. Option D, intradermal. The correct option is option B, IM with Z-track. A patient with COPD on oxygen therapy develops drowsiness. The most likely cause is option A, oxygen toxicity. Option B, CO2 retention, hypercapnia. Option C, hypoxia. Option D, metabolic acidosis. The correct option is option B, CO2 retention, hypercapnia. In a patient with increased ICP, which nursing intervention is contraindicated? Option A, elevate head 30 degree. Option B, maintain neck alignment. Option C, frequent suctioning. Option D, avoid coughing. The correct option is option C, frequent suctioning. Which electrolyte is most responsible for cardiac contractility? Option A, sodium. Option B, potassium. Option C, calcium. Option D, magnesium. The correct option is option C, calcium. Contraindication of nasal intubation is option A, conscious patient. Option B, fracture of base of skull. Option C, patient with limited mouth opening. Option D, intraoral mass. The correct option is option B, fracture of base of skull. The best position for doing lumbar puncture is option A, left lateral. Option B, right lateral. Option C, Fowler's position. Option D, prone position. The correct option is option A, left lateral. The most sensitive indicator of renal function is option A, blood urea. Option B, serum creatinine. Option C, urine output. Option D, GFR. The correct option is option D, GFR. A patient develops sudden dyspnea after surgery. The nurse suspects pulmonary embolism. Priority action. Option A, administer oxygen. Option B, start IV fluids. Option C, check BP. Option D, call doctor. The correct option is option A, administer oxygen. A patient is having hyperventilation and CO2 level is below normal range. Priority nursing management in this patient is option A, paper bag breathe. Option B, give O2 directly. Option C, inform the doctor. Option D, give sedative. The correct option is option A, paper bag breathe. According to WHO, what is the management of the second stage of labor? Option A, pushing with Valsalva maneuver. Option D, monitoring fetal heart rate. Option C, perineal massage. Option D, emergency C-section. The correct option is option B, monitoring fetal heart rate. A child having diarrhea shows sunken eye and is eagerly thirsty. When milk is provided to the baby, it drinks it eagerly. Which type of dehydration is in this patient? Option A, mild dehydration. Option B, moderate dehydration. Option C, severe dehydration. Option D, normal. The correct option is option B, moderate dehydration. Function of zinc in management of diarrhea is option A, increases appetite. Option B, resolves abdominal cramps. Option C, maintains dehydration. Option D, prevents induration. The correct option is option C, maintains hydration. In a newborn, APGAR score at 1 minute is 7. Nurse found that the baby's mouth corner is stained with secretion of meconium. What is the next best step? Option A, prepare for resuscitation. Option B, inform physician. Option C, perform the suction of mouth and nose. Option D, perform the routine care. The correct option is option C, perform the suction of mouth and nose. In a patient, apical pulse is 80 per minute and radical pulse is 65 per minute. Identify pulse deficit. Option A, 10. Option B, 15. Option C, 25. Option D, 35. The correct option is option B, 15. Which position is best for a patient with air embolism? Option A, supine. Option B, Tendelberg, left lateral. Option C, sitting. Option D, prone. The correct option is option B, Tendelberg, left lateral. Which condition causes widening pulse pressure? Option A, shock. Option B, aortic regurgitation. Option C, cardiac tamponade. Option D, heart failure. The correct option is option B, aortic regurgitation. Which is the priority in anaphylactic shock? Option A, IV fluids. Option B, antihistamine. Option C, epinephrine. Option D, steroids. The correct option is option C, epinephrine. Which lab value indicates effective heparin therapy? Option A, INR. Option B, PT. Option C, APTT. Option D, platelet count. The correct option is option C, APTT. An asthma patient comes to emergency with complaints of wheezing and chest pain. What should be the flow rate of oxygen for this patient? Option A, 2 liter per minute. Option B, 5 liter per minute. Option C, 10 liter per minute. Option D, 15 liter per minute. The correct option is option A, 2 liter per minute. Desired dose of morphine for a patient is 0.4 mg. Dose available is 1 mg per ml. The correct formulation for this patient is option A, 0.4 ml. Option B, 0.8 ml. Option C, 0.2 ml. Option D, 0.3 ml. The correct option is option A, 0.4 ml. A burn patient develops curling ulcer. Cause is option A, stress. Option B, infection. Option C, hypoxia. Option D, drug reaction. The correct option is option A, stress. In Addison's disease, which electrolyte imbalance is expected? Option A, hypernatremia. Option B, hypokalemia. Option C, hyponatremia and hyperkalemia. Option D, hypercalcemia. The correct option is option C, hyponatremia and hyperkalemia. For a patient, the desired dose of a drug is 200 mg/d. The available dose of this drug is 0.1 gram. The correct dosage for one dose of this drug is option A 1 tablet, option B 2 tablet, option C 3 tablet, option D 4 tablet. The correct option is option B 2 tablet. The flow rate of a drug is shown as 50 ml in 15 minutes. The correct flow rate of this drug is option A 150 ml per hour, option B 50 ml per hour, option C 200 ml per hour, option D 100 ml per hour. The correct option is option C 200 ml per hour. Thank you for watching. Please like and subscribe.